I would like to thank the scientific committee firstly for creating such an amazing event and enabling me to present. Thank you very much. I also feel very honoured to be in this room. There's some amazing, creative and astronomically intelligent people in mind. Thank you. I would first also like to consider our professional colleagues around the world, highlighting their need for support in this time. I would really love it if people could turn their videos on. Some of them cannot work at the moment or speak out of what's happening for risk of their families and their own lives. So please know that we see you, we feel for you, and we hope for a better future. Thank you. We'd really just love them to return to continuing doing their job that they love. So again, if you could turn your cameras on, that would be fantastic. All right. So last week, like many of you, I was sitting in my clinic, sitting on the stool, unpacking my instruments, listening to a client talk about how she read on the internet. It was my 5th client for the day who was saying something similar, and I was getting a little bit flushed and a little bit frustrated. And I was wondering why. Have I not done enough? Have I not given her or them everything they need? So in the next 20 minutes, I'm going to tell you 3 ways that can make your practice more distinguished, more supportive, more connected for each individual client, which also will equal less burden on you, feeling less physically flat, less emotionally and mentally drained. And hopefully that you'll leave your day feeling like you've had a greater impact on your clients. And then they'll recommend you for that, essentially. So my name is Natasha Hogan. I am a healthcare professional of 20 plus, nearly 25 years experience. And I've also been on the other side of my topic. I've been an emotionally needed, anxious client, pregnant after infertility, wondering if I would next week still be holding on to my baby. So after my 2nd pregnancy, I started to write a book. I had no intentions of writing a book, but it became a guide to what's next and what's different after infertility, mostly for clients, just for patients. It's going to be released in February 2023, next year, but that's not the reason why I'm here. I didn't want to stop there, essentially. I realised that I hadn't been taught that in today's world, essentially we are more like health coaches and mentors than we know. Now, why is that so important? We currently are experiencing, oh, I've realised I've forgotten to show you my slides. I'll just open that up. So this one. That was the acknowledgement, frustration, things we go through. The 3 gifts that I want to give you. Obviously, that's myself and my husband and my firstborn. So we're up to this one. It's important because everybody's searching for connection at the moment. Since the COVID pandemic, we've had exponential growth. Did I share that? That didn't work. Sorry, guys. All right, I'll go back to the, yeah, I'll just start there, that's fine. I'll show you the photo of me. Is that sharing? Can someone confirm to me that that's sharing okay? I'm hoping that it is. Okay, yeah, exponential growth. So it's not necessarily that there's a lot of people out there who aren't academically trained who are looking to talk to your clients. They are aiming to talk to your clients, to chat to them, because it's a time that everybody's looking for connection. They really, really, really want to feel heard, feel important. So essentially, it's a bit like the Roaring 20s, a little bit of fun. What they, again, they're not academically trained. So essentially, okay, I'm hoping that the slides are working. They're trying to convince your clients that they need that client, they need that coach, okay? So you're the medically trained coach, they're just a coach in a life sense, but essentially they're not the ones that are going to be going through the medical journey with these patients, but they're still asking the questions. So because of that lack of, let's go back to the gift number 1. I would just really want you to first acknowledge that we are essentially, how does it click on to the next one? Okay, we are coaches and mentors. We say and do, what we say and what we do to educate our clients is important. For the clients that are academic, for the client to see an academically trained person who can then actually give them evidence-based practices is the most important thing. But essentially, we still need to be able to interact with them well. And I think sometimes we're losing that. And the research does actually show that, okay? We want the client to be able to take on our information, our education, then we want them to be able to process that, be able to understand and resolve their situation and their concerns for what they're doing in their journey. We certainly don't tell them the answer. Obviously, our duty of care is to them and to them making that decision. We don't tell them what to do, but what do other coaches do well that we don't necessarily do? What I've seen is 2 main things. They don't hold back in their uniqueness, and they certainly show their personality. They don't always have to be perfect, and they are all professional. Most people feel more comfortable when the practitioner essentially shows some of their own character and their own style. It enables them to be a bit of, it can be a conversational starter. So I like to wear earrings, and I have a different scrubs every day. They've got patterns on them so that the client can actually use that as an icebreaker, or we can use it as an icebreaker. You know, so essentially it's not a sterile environment. They get to acknowledge that there's life outside of what they're going through, and they also get to leave their internal struggle on the inside. Okay, it can break the uncomfortableness of what they're feeling, and they're reducing their anxiety. So the anxiety, especially for women pregnant after infertility, is a huge issue. It's just not being recognised enough. Yes, all women can suffer anxiety during pregnancy, but pregnant women after infertility is a whole different ballgame. Essentially what we want is for you to resonate with that client really well. They want to go beyond, we want to go beyond the basic psychosocial model, okay? Filling out that intake form that tells you a little bit of information about their background, family background, social supports, cultural traditions, economic status, and educational level. So gift number 1 is to acknowledge that you're a mentor and a health coach in a sense. 2, gift number 2 is to be you, okay? Don't be sterile. If they can't connect with you, they won't feel safe. A coach facilitates a safe space. They inquire about the changes to their well-being, their emotional well-being, their relational things that are going on for them, what's happening chemically, and they value that the person sitting in that chair has a purpose, has safety and security issues, and that they change daily in some of these situations. That's the clinical. See how it can just be quite clinical. So a little bit of colour. I mean, this medicine is not really colour. It's all about how you are. I'm not saying we all have to be extroverts and we all have to be out there. I'm just saying that we actually need to take on board what the literature is telling us, the research is telling us, okay? I'll go to the next one. We want them to feel heard. We want to listen to them. We want to inquire about what's actually going on for them, see all perspectives so that we can educate them and help them see all the perspectives of all the evidence-based options. Because if they're not feeling that way, they're not going to actually take on board what you're saying. We want to ask them their whys, which is their own solutions. Why does that work for you? Why would you like that? Doing X, Y, and Z may have to change during the birthing process. What would be your next why that would be okay for you? Okay, the backup plan of the why and the what, and why is it important to you? So your journey of birthing your baby is enjoyable and a lovely experience, and so is the post-birth as well. So practically slow down, listen, be involved, enjoy holding that space for your clients, because essentially it's going to impact you as well. If you slow down, you're potentially giving yourself a chance, this is gift number 3, to enjoy the journey with them, okay? And if you're enjoying the journey with them, that experience becomes an experience. Like, people are buying experiences out of this world at the moment. I want to go here, I want to do this, I want to do that after the COVID pandemic, okay? You want to provide an experience so that they can enjoy the journey, you enjoy the journey. So slow it down with your clients. Actually give yourself time to pivot, reorientate your pre-programmed processes and expectations of how you clinically work. Okay, so then clinically you'll find that while you're supporting your client, you're also supporting yourself. So for clients to truly benefit from your connection, you need to create that identity that you want them to have. So what you are saying that is good for them, you also need to show. So the work-life balance, generating positive self-talk, exercise, eating well, sleeping better, hydrating, and meditation. Now, I'll get to the research. So a recent Brazilian study, 2022, showed that the infertility-related stress scale, IRSS, was valid and was deemed reliable, enabling identification of patients who needed support in the intrapersonal, so life satisfaction, mental well-being, leisure, pleasure, spirituality, and the interpersonal, so the social associations, the connections, the degree in which the intimacy was there, and how they felt in those relationships. Interestingly enough, the highest stress indicator came to be the blood relatives and the in-laws when it comes to infertility stress, because of the stress caused by the impacts of their infertility and the treatments, okay? The duration and the infertility stress went up and continued to go up until 6 years into being infertile. And then it started to decrease, likely to the intrapersonal acceptance over time. So there's that constant increase of stress. So during your treatment process, if you're not addressing all these things that they actually need to feel connected, essentially, you're not going to have outcomes, okay? So if we can address those things, and like I said, at the 6 years, it starts to go down because they start to actually accept their identity, okay? They accept the relationship situations that are going on. It's a journey, okay? It's a journey, but the emotion, we'll also go to the next, oops, so there's my slide on health literature, apologies for that. That was the, this is the next one, emotional well-being and support of infertile patients, with treatments in the clinics included enabling and embedding counselling and mental health care providers within their treatment, acknowledging and assessing constantly as a team creates more feasible outcomes. So there's benefits for the patients, benefits for the provider, as well as the team when it comes to health culture, work culture, and even more beneficial to your bottom line, essentially your business. What am I saying here? I'm not saying that we need to go off and do another degree yourself. You just need to be trained to assist your clients differently than what we've been taught and what is happening or has happened in the past. I'll just go to the next one here. So psychological well-being, EWB, of infertile women has proven to be non-statistical or significant regarding their age, their occupation, their place of residence, their economic status, and their spouse's educational levels, okay? But what was shown was the education level of the mother, the duration of the treatment of infertility, the failed attempts, and especially in relation to those who don't fall pregnant versus those who do. Okay, so there's a lot of information in there, a lot of information that we can work with and tweak to actually make sure your clients are feeling connected along the way. Okay, the harder the treatments though, the more likely the PWB will be decreased. They're not feeling so great, with some of them stating that they felt out of control of their lives. Okay, now if they're feeling out of control of their lives, there's a huge social pressures to be having babies, there's all of these things going on. This is when we're risking people. So we do need to address this stuff, okay? It's imperative because it shows that all of these variables can be utilised to help prepare clients better to create educational and counselling programs. The other consideration is that we now know a lot more about neurodiversity. So again, we're looking at considering their educational levels, but also their learning and their working memory. Are they able to recall what you've just said quickly and easily, or is it something that in their processing they just cannot do? All right, again, it comes back to some are very sound sensitive, so if your clinic usually is pretty quiet, but even an echo can be something, or a clicking clock can be something that just upsets that ability to take information. We're living in an era of information overload and extreme availability, but are we really using it? Okay, we have to be able to be present, educate, treat, and reassess so that the client is able to take in the information, process it, feel cared for and supported. Sounds like a lot, but we can do it, and we do it, and it's happening, but I think we can do it a lot better. Another recent article I read talked about creating conferences like this one now to consider the neurodiverse, okay? So special aspects to specific breakout rooms, so also smaller attendancy rooms, less noise, less volume, communication icons that suggest, yes, I am open to conversation, or no, I'm not open to conversation at this time. These are all things that we actually do need to consider. The way in which we present does require change. What we learnt at university 10, 25 years ago essentially is not appropriate anymore. So recap the three things. We need to hold space, and I think I've got a little picture there. Hold space to take in the process, connect, increase the trust, increase the confidence, the why and the how, increase your outcomes, essentially, okay? I know you want to be impact driven. I know that you want your psychological well-being of your clients. And so essentially we'd like you to become a part of the research group, a founding member of our mentorship program, creating a specialty area, the field of pregnancy after infertility. Within women's health, it is possible. It really is possible with further research, which is what I'd love to do a little bit more of. We've got lots to do. It will benefit both the client and the practitioners. And if done, considering all of these aspects that I've spoken about today and more, no doubt. A LinkedIn survey in 2022, also recently this year, on work satisfaction highlighted that our ability to learn and grow within our work environment is of the utmost of importance. Why am I telling you this? This is the extra part of going the extra distance and keeping your staff and your retention, engagement, and overall aids your work culture. So you're improving your bottom line for your business. Lastly, I also remember in a very different clinical environment a few years ago when the phone rang and I received the news that nobody ever really wants to hear. A colleague of mine had taken his life. Unfortunately, I knew that he seemed off. The last time we talked, he was exhausted, he was discouraged. But back then I didn't know how to recognise what was going on I couldn't assess a professional not being able to cope, but it does happen. We all get burnout. Yeah, now I believe I understand more of the struggle signs. I can usually identify when someone needs help and talk them through it. I don't want to miss any of our practitioners in this sort of situation again. We've lost too many already. I particularly know of 5 people, which is really, really hard to digest sometimes. So that's why I'm talking about work culture. That's why I'm talking about creating a really good team. If you feel supported as a client, you feel supported as a practitioner, you're going to get better results. So there's lots of reasons why I'm passionate about where I'm going with pregnancy after infertility. Essentially, you guys create life. You bring into the world the most amazing babies, and we're so grateful for it. You're important to the whole generation that's coming along, the future generations all over the world, but especially pregnant after infertility families. They hugely require your assistance in this area. So I really hope that you will consider having a look at the website and checking out the mentorship program. Thank you for your time and your passion for your work. I just really want you guys and your clients to have a brighter future. So thank you.